It's time for Truth or Fake. Catalina Marchand-Abreu is here in studio. Catalina, in today's edition, the HMPV virus outbreak in northern China. Some users are claiming that a new lockdown is upon us. Tell us more about what they're saying.
That's right, Sharon. A surge in cases of the flu-like human pneumovirus, also known as HMPV in China, has raised fears of another COVID-style pandemic. According to this Chinese CDC statement, actually since last December, cases of HMPV amongst people under 14 years old, especially in northern China provinces, were trending upwards. The talk of this virus is shaking up social networks with talks of states of emergency, lockdowns, mortality rates. Let's take a look at some of these alarmist claims going around, starting with the local situation in China, where this post from January 7th, this user says, schools in China close as HMPV infections surge, where we see in the photo added the similar scenes from the ones we lived throughout the COVID-19 pandemic, while users also claim that a state of emergency has been declared in China as the epidemic overwhelms hospitals and crematoriums with a mix of multiple viruses spreading rapidly across the country. Then other users also say that the mortality rate of this virus reached a staggering 43%. As this user says, pandemic 2.0 has begun, as it seems we found at least more than 50 accounts on TikTok that have been posting more alarmist content. For instance, this one, a warning of an alleged lockdown that will take place here in France following announcements from President Emmanuel Macron. Content also vaguely citing official sources in China and Europe without naming them explicitly, as the same claims have also been made in English in TikTok following the threat of the spread of this, what they call a new virus.
Take us through some of the details then, Catalina. Have you been able to debunk these claims?
Well, let's begin with this image of emergency workers. We conducted a reverse image search and we found that this photo was actually taken by AFP journalists. It was taken in 2022 in Beijing during the actual COVID-19 pandemic. So already a photo that has been miscaptioned on social media to alarm users about the current situation in China, where no state of emergency has been declared so far. The World Health Organization issued a press release on January 7th saying that Chinese authorities report that their healthcare system is not overwhelmed per these claims that we just saw, and that there has been no emergency declarations or responses triggered by the surge of this virus. There has also been no official statement from French President Emmanuel Macron or other world leaders declaring an upcoming lockdown due to the spread of this virus. And we actually found that a large portion of the TikTok videos and content like this one come from, for example, parody accounts on TikTok. For example, this one called P News that describes itself even as the source of disinformation on their caption, with extremely viral videos like the one we just saw. Here's another example of another fake lockdown video of HMPV virus, as social media has been fueling these fears of a new pandemic with the surge of this virus in northern China.
Finally then, Catalina, tell us a little bit more about the virus itself, mortality rates, how it spreads, how to prevent it from spreading.
We'll begin by debunking these claims about the virus that reaches a 43% mortality rate. We found this figure in a study published in 2013. And while this study does reveal that this mortality rates of this virus at 100 days were 43%, this rate only concerns a specific population. This would be patients, for example, with leukemia. So there might be, as usual, a high mortality rate for very high-risk groups like these, but this mortality rate does not apply to the general population, according to experts that we've interviewed. The HMPV virus is also nothing new, contrary to lots of claims that we've been seeing online. It was actually discovered back in 2001, so it's been around humans for at least several decades, giving us time to create these antibodies against the virus, a respiratory virus known to cause symptoms similar to colds and to flus, such as fever, runny nose, nose, coughing, and that normally spreads faster during these winter months. Margaret Harris from the World Health Organization assures us that there's currently no abnormal increase in this virus, not considered to be a health threat that would require exceptional measures such as a lockdown per the fake claims. For now, there's actually no vaccine against this virus. Experts advise simple preventative measures such as masks or sneezing into your elbow, washing your hands, measures that we learned throughout the COVID-19 pandemic, as health officials in China have declared on Sunday that the rate of the HMPV infections in northern China has are declining amid this concern over a potential new pandemic.
Catalina, thanks for taking us through all of that. That's Catalina there with this evening's Truth or Fake. Well, that's it from us for now. Do stay with us, though. We'll be right back with more world news.